Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. In this procedure, a patient attended with 2 huge boulders of earwax, one in each ear, and we're just starting off with the right ear. And this plug of wax is really dry and hard in texture. It's almost stone-like. It extends from the entrance of the ear towards the eardrum, and I'm just using a Zollner suction probe to perform microsuction, and we're just trying to detach the plug from the canal walls, which I have, and I'm now trying to bring this forwards. Now, when you've got a hard plug of wax like this, it can sometimes be difficult to get an adequate seal, an adequate suction grip, and sometimes you can accidentally actually push the wax further in the ear, so just being really careful not to do that, because it's quite a hard piece of wax. If you do push it against the canal wall or eardrum, it can be slightly uncomfortable for the patient. And I'm just at the top of the plug here, and I'm kind of almost rolling it down and then bringing it forward. And you can see the canal bend, it veers off to the right, so I'm just navigating this wax plug around the bend, and there we are. So it's been there for a while. I can tell by the colour it's oxidised. Nice healthy eardrum with the distance. I'm just going to mop up this bit of dry skin right on the cartilaginous portion, so we can put a bit of pressure on the canal walls. That's the right eardrum. This is the patient's left ear. Again, it's a really hard plug. I'm going to start off once more using the Zollner suction probe, and I'm just going to the bottom right of the ear canal over here. So so this is the left ear, similar to the right, but when you enter the ear, and in the case of the left ear, there's a blind spot on the right-hand side. We call that the posterior portion of the ear canal. And in the case of the right ear, when you enter the ear to the left, so the posterior canal on the right ear as well, there's a bit of a blind spot, and quite often wax can get trapped there. And if you can detach it from the posterior lateral, because it's near the entrance, we call it posterior, so to the back, and lateral near the entrance. If you can detach the wax plug from the posterior lateral canal wall, it can immobilise the wax and make it a bit easier to remove. Now, I was finding it hard to get a suction grip here, and I was worried I was pushing it further in, so I've just glided a St. Mark's ear hook horizontally at the roof of the ear canal. You would have seen there's an opening there. And once I got over the wax, it was quite deep in the ear, very gently I rotated the hook so it locked in behind the plug of wax, and I slowly brought it forwards. That's the patient's eardrum, nice and healthy. I'm just going to again mop up around the entrance. We can leave that if I'm the truth be told, but because we're on the cartilaginous portion, I'm just hovering over. There's a bit of dry skin flakes there at the base of the ear canal. That's on the bony part. We just left that. It's not going to cause an issue. In fact, it can clarinet if we try and remove that. So these are the 2 plugs. You can see how dark they are, so it's oxidised. Well, I hope you enjoyed that video, guys. Take care. Speak soon.